Hello there. Are you suffering from many bruises, unusual bleeding, pain, swelling in joints, nosebleeds, or blood in urine or stool? Then you might have hemophilia. Now, what is hemophilia, you may ask? You see, hemophilia is a rare disorder in which your blood does not clot, and this can be very dangerous. Now, it's a recessive gene in which both parents must carry in order for you to have this disorder. Now, hemophilia is caused by a missing or defect in factor 7. When a person with hemophilia gets a cut, they don't have the proper blood clotting factors to stop the bleeding. Now, this is a very scary disorder to cope with. The treatment options are to receive the missing blood clotting factor into your veins. Now, if you're not suffering from the symptoms of hemophilia, you may be suffering from fevers or chills, persistent fatigue or weakness, progress in severe infections, losing weight without trying, swollen lymph nodes, enlarged liver or spleen, easy bleeding or bruising, recurrent nosebleeds, or tiny red spots in your skin. You may have leukemia. And for those of you who don't know, leukemia is a cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. Many types of leukemia exist. Leukemia usually involves the white blood cells. The four main types of leukemia are acute lymphocytic leukemia, which is more common in children and begins in the B and T lymphocytes. This can also spread to lymph nodes, liver, and spleen. Then there is also acute myelogenous leukemia. It is more common in adults and can affect all types of blood cells, but mainly white blood cells, and tends to progress quickly. Then there is chronic lymphocytic leukemia. It is the most common type of leukemia, and it begins with the B lymphocyte and can progress quickly or slowly. And then finally, there is chronic myelogenous leukemia, which is a very rare type of leukemia. It's about 10% of all leukemias and mainly occurs in adults. This occurs when a genetic change turns the myeloid cells into immature cancer cells. Treatments for leukemia include chemotherapy, radiation therapy, biological therapy, targeted therapy, and a stem cell transplant. Combinations of these treatments may be used. Surgical removal of the spleen can be a part of treatment if the spleen is enlarged.
Thank you for watching. If you have any of these symptoms, go see a doctor.